Jose, we're on Health Watch at 8:34 this morning, and as part of Skin Cancer Awareness Month, experts are asking you to get naked. Here to explain is Dr. Sherry Ingraham with Advanced Dermatology. Good morning to you, Doctor.
Good morning.
And thank you so much. I didn't catch your name.
Michelle.
Michelle, thanks for coming in.
You're welcome.
All right, Doctor, so we're talking about types of skin cancer. So what exactly should we look for?
Well, really in general, what you want to look for is what we call the A, B, C, D, and E. So A is asymmetry, B is border, if the border is expanding, changing, C is color, if the color is varied, D is diameter. So we often say 6 millimeters, but if it's even irregular and both, smaller than 6 millimeters, we need to look. And E is evolution. If you had a mole, it starts to grow, change, bleed, itch, come in and show a board-certified dermatologist.
Okay, so if Michelle went before you and said, I just want to get my skin checked, where exactly would we start?
Okay, so we always start at the head. And I'm showing you this because I want people to know at home how to give themselves a thorough skin check. So I oftentimes, and everyone does it a little differently, we'll start at the head, and you want to look through the scalp. So this is when you get a loved one. You can get your husband, a child, a relative, or even your hairdresser to look through the scalp. And I always tell patients, hairdressers find a lot of important things. So you want to part the hair and look through every segment of the scalp. You want to look at the ears, behind the ears. These are places that skin lesions can hide. Of course, you want to make sure you look at the face, you open the eyes, look inside the mouth, and then we work our way down the body. And ideally, the patient wouldn't have any clothes on. We can't do that on TV, of course.
Right.
And you're going to look at the arms. Skin cancer, especially melanoma, can occur even where the sun doesn't shine, and I think that's a misconception. So it can be on the palms, it can be between the fingers.
And are you looking specifically for discoloration? Are we looking for moles? What exactly?
I'm looking for moles. So for melanomas, you're looking for darkly colored moles, irregular moles. For basal cell and squamous cell cancers, they can even just look like a bug bite. It can have a little bit of red dotting, bleeding, a rolled border. But melanomas are what you're looking for when you look at atypical moles. We work our way down the body. We even look under the underwear. We look down the legs, and we don't want to forget the feet. In certain populations, African American populations, melanoma can be found on the sole of the foot particularly. So we often look down the foot, we look between the toes, we look at the bottom of the foot. So you really want to look at every surface. Now what you do at home is you take a mirror with you, a hand mirror, and you look at places where you can't see. So you can do it in front of a full-length mirror or take a hand mirror with you, and of course have a loved one look at your back and your scalp for you in places you can't see.
And Michelle, do you have any type of moles on your body that you question or maybe that you've noticed?
You know, actually, I don't have a lot of moles, but Sherry, Dr. Ingraham actually has checked moles for me before.
Okay. And so, Dr. Ingraham, I was asking you about a particular mole, specifically this one on me. It's very dark, and every time I'm wearing sleeveless or, a little tank top, people point it out all the time because it's so dark.
Right, and I think it's great that people are noticing and that people are more aware because you are a young woman. And what we're finding is typically melanomas we think of as being very, very concerning. They're very, very deadly if they're not caught early. If caught early, melanoma approaches 100% cure rate if caught and treated within the first few months or years of it being noted. However, we are finding that women, young women, 45 and under, is one of the fastest growing segments of population with melanoma. In fact, young people 25 to 29 years old, melanoma is the most common cancer they have.
Okay, we're going to talk about prevention, but Michelle, I have a question for you. Do you wear sunblock, sunscreen?
Yes, all the time.
All the time? Does your makeup have it as well?
Yes, it does.
All right. Dr. Ingraham, you want to chime in on that and the importance of it?
So why is skin cancer increasing in number in this age group? Because of tanning beds. So if you use a tanning bed, your lifetime risk of melanoma increases by 75%. This is a preventable illness for the most part. So sunscreen is crucial. You want to use an SPF 30 or higher. Rainy day, sunny day, 40 degrees outside, it does not matter.
Even when it's cloudy out, you got those UV
when
rays.
It's cloudy.
Doctor, I hate to cut you off, but we got to let you go. Thank you all so much. And Michelle, thank you for coming in. We really appreciate it for being a good sport.